do you judge people by the way they carry their bags on one shoulder?
Pain in the shoulder is also contributed with the neck.
So these are some golden rules that you have revealed.
In arthroscopy, there is no need to cut through the muscle. We just pass through the muscle. Pain is lesser compared to an open surgery. So your rehabilitation and recovery is faster.
In this episode, we're going to discuss about shoulders, a joint which works much harder than most of us at the gym. From lifting gas cylinders to lifting egos, the joint does it all. So welcome to the program, Dr. Sukesh, and it's a pleasure to have you.
It's a pleasure here too, Dr. Lakshmi.
So tell me honestly, how many shoulders do you actually see in a day? And also, do you judge people by the way they carry their bags on one shoulder?
On an average, I generally see around 15 shoulders a day. Yeah, definitely carrying your bag on one side or on both the shoulders makes a difference. And some patients end up with pain in the shoulder joint.
And most of the patients, I'm sure, they say that, I haven't slept the right way. That's why I'm having the shoulder pain. Is that the fact always?
It's not always a fact because we have to understand that pain in the shoulder is also contributed with the neck. So most of this pain is because of the neck problem rather than the shoulder problem.
But honestly, is the shoulder joint a very complex and dramatic joint than when compared to the other joints in the body? Why is it so special under?
Shoulder is one joint in the body that can rotate in 360 directions. So it is the most mobile joint and it is the most versatile joint. And shoulder joint annappudu, it's not one joint. It is actually a mixture of three joints. So that's why it is complex, it is fascinating, and it's versatile too.
And also it's very flexible, and that's why it's very risky under.
Definitely, it's flexible. That's the reason it's covered by a lot of muscles. Some of these muscles tear up and they may cause problems. So any imbalance. So it is a very balanced joint as a matter of fact. So any disruption in balance will cause shoulder problems. That is why shoulder problems are so common nowadays.
So what are some common problems that most of us would encounter after hitting a certain age with the shoulder, doctor?
It depends, like what you said, age. So that is where your shoulder problems are differentiated. So young age, when you are less than 30, when you engage in sports, when you are more active, the most common problems that we see are either shoulder dislocations or slap tear, that is a muscle tear into that. But after the age of 40, 45, when the joint starts wearing, wear and tear start avutundi. So that's the point where we see these two more common problems, in that one is frozen shoulder, the other is rotator cuff tear. Advanced age, when you are more than 65, again you have rotator cuff tears and arthritis. So like in knee joint arthritis, you also have shoulder joint arthritis.
So now comes the scary part, or the scary word, that is arthroscopy. I mean, it sounds like a space mission, something like that. So how would you explain the mana general population? How do you explain this?
Actually, the name is big, but the work is small. So basically, arthroscopy is nothing but a keyhole surgery. Manamu abdomen lo we do laparoscopy. The same thing when we adopt it to shoulder, it's called as arthroscopy. Previously, we used to open the shoulder joint for all the problems. But arthroscopy lendante, we put a camera inside the joint and we see the problem and we try to solve the problem. So it has revolutionized, especially tendon injuries, shoulder instability, it has revolutionized the way we do the surgery. So it's actually, in fact, very beneficial for patients, and it's a good word for patients actually.
So it's like a mobile phone surgery instead of opening your laptop, antara?
Exactly like that. It's a very minimal invasive, hardly have any stitches. So it's a very good surgery.
So with a small keyhole, we'll be able to access the entire joint, antaru, and the surgery is very much simple than compared to the traditional way.
Definitely. Open chair, we have to understand that shoulder is a complex joint. Shoulder joint chutturta muscles untayi. So mana joint reach avvali anante, we have to cut through a lot of muscles. But whereas in arthroscopy, there is no need to cut through the muscle. We just pass through the muscle. And so we avoid a lot of pain and disability to the patient.
సో దీంతో పేషెంట్ కి కూడా అడ్వాంటేజెస్ చాలా ఉంటాయి అంటారా ఈ ప్రొసీజర్ తో?
Yes, arthroscopy తో ఏంటంటే the main advantage is early rehabilitation. అంటే the pain is lesser compared to an open surgery. So your rehabilitation and recovery is faster. And second thing is cosmesis. That means we don't, because we don't open the joint too much. And in diabetic patients where the possibility for infection and all is there, shoulder arthroscopy dwara we avoid those infections and all.
And also the patient gets discharged faster, I believe.
Definitely. So they get discharged the same day or the next day after shoulder arthroscopy.
So what are some common myths or questions that patients usually mimmalni adutaru when you say, this procedure has to be done through an arthroscopy?
We have to make them understand that shoulder arthroscopy is a keyhole surgery. So we don't open the joint. So మన కెమెరాలోనే లోపల చూసుకొని we address whatever problem is there inside the joint. So that is one myth that we try to say. And second thing regarding rehabilitation. So with shoulder arthroscopy, rehabilitation better గా ఉంటుందని patients మనం generally explain చేయొచ్చండి.
So what are the other latest advancements which we are seeing today, especially in shoulder surgery today, doctor?
సో వన్ థింగ్ ఒకటి ఏంటంటే మనము రోబోటిక్ జాయింట్ రిప్లేస్మెంట్ వస్తుంది షోల్డర్ జాయింట్లో. దట్ ఈస్ వన్ న్యూ థింగ్ దట్స్ కమింగ్ అప్. ద సెకండ్ థింగ్ ఈస్ కస్టమైజ్డ్ ఇంప్లాంటేషన్. అంటే పేషెంట్ స్పెసిఫిక్గా మనము ఇంప్లాంట్స్ ముందే త్రీడీ సీడీ చూసి 3Dలో మనకు పంపించి ఆ 3Dలో వాళ్ళు డిజైన్ ఇట్ అండ్ దే గివ్ ఇట్ టు అస్. అండ్ థర్డ్ మోస్ట్ ఇంపార్టెంట్ థింగ్ ఈజ్ పేషెంట్ స్పెసిఫిక్ ఇన్స్ట్రుమెంటేషన్. అంటే ఎవ్రీ పేషెంట్ ఈజ్ సైజ్ డిఫరెంట్లీ. So we can't use the principle of one size fits for all. So we get a CT done and we customize the jig for the particular patient so that the results for the patient are very good.
Just like how you do the designer outfits, one fit doesn't fit everyone.
Exactly, you can say it in that way, definitely.
So tell me honestly, what's tougher, shoulder surgery or doing this podcast where you have to sound medically correct?
I think this podcast is more difficult for me. Shoulder surgery, I think it's part of my life now. I've grown accustomed to it and we see many patients and it's been my life now for a long time.
So what are some secret daily things that most of us would be doing that would be hurting the shoulder?
One thing is texting, what we frequently see, and that's one that can cause neck pain and also shoulder pain. The other aspect is, I think, the habit of lying down in bed and using your laptop or watching your phone, so wherein you put pressure on your elbows. So that causes a lot of pressure on your shoulders. So that can also cause shoulder dysfunction.
And also most of us anukuntaru, rolling the chapatis causes shoulder pain. Is that a myth or
I think that's a myth. That does not cause any shoulder pain. On the other hand, it may cause elbow pain, tennis elbow cause cheyochu, but otherwise it has no effect on the shoulder.
Are there any exercises or some stretches that we can do at home to keep our shoulder strong, doctor?
Definitely. I think we have to incorporate some things as a part of your life. సో మనకి జనరల్ షోల్డర్ స్ట్రెచింగ్ ఎక్సర్సైజెస్, తర్వాత డెల్టాయిడ్స్, మనకి సైడ్ పక్కకుండా మజిల్స్ ఉంటారు, డెల్టాయిడ్స్ అంటారు, వీటిని స్ట్రెంథన్ చేసుకోవడము. తర్వాత వీ హ్యావ్ దిస్ బ్లేడ్ ఆన్ ద బ్యాక్ ఆఫ్ ద షోల్డర్ కాల్డ్ as scapula. The scapula is the main base on which the shoulder rests. So that is stabilizing exercise. So doing these exercises will definitely reduce a lot of shoulder problems.
So these are some golden rules that you have revealed for everyone today for a good shoulder health.
Thank you.
So what's your secret mantra for your healthy life or fitness?
I think it's family and my moment of time. So I take out some time every day for myself. I do some regular workouts and spend time with the family. That's one more important aspect. It what I call de-stresses a lot. And try to keep myself updated. That's one thing that I love. So these are some things that I follow.
So during workouts, do you secretly judge people by looking at them and mentally calculating their rotator cuff health?
Yeah, it goes unconsciously. I think it's part of job. You see people around. But the only one thing that I generally advise is when I see somebody overstretching themselves, in general parlance, manam maatladetappudu, any overexertion is bad because all muscles have certain yield strength and each of us is built differently. We can't compare one with another. Just because somebody does 50, you have to do 50. You have to do what is right for your body and do it gradually. So when somebody overstresses or overexerts himself, I just randomly try to give an advice from my side.
So ice pack or heat or some hot oil massage, what's better for the shoulder?
I think if it's an acute injury, ice pack is the best thing. But if it's a chronic problem, then a hot pack would be better for the patient.
No role for the oils?
I don't think so. I'm not comfortable with the oils at all.
So everyone talks about six-pack, abs and everything. But is there anything for the shoulder as such?
I think it's more the contour of the shoulder. Yeah, whenever you work out, I think your biceps, that was the original way you see. So you have bulging biceps. And you also have ripped deltoids. But I think that comes with the part of the entire body.
But it's such an underrated joint that no one talks about it, right?
Exactly.
And finally, Dr. Sukesh, what is that one message that you would like to share with our viewers out there? Who's someone who's suffering from shoulder pain or he wants to look out for a doctor? What is that message that you would like to share?
I think don't suffer with your shoulder joint pain for long. You can try home remedies. If the pain is mild, that's not an issue. But when the pain is persistent, when it's prolonged for a long time, that means it's there for months and months together, or it is accompanied by weakness, I think you should consult your doctor. Have an opinion. Don't be afraid. I think the shoulder is now, the myths about the shoulder joint are basically demystified nowadays. So need not worry about it. I think treatments are pretty straightforward. The outcomes are pretty straightforward. And not every shoulder pain needs a surgery. Most of it can be managed non-operatively with medication and physiotherapy. And surgery will be always the last resort.
So thank you, Dr. Sukesh. That was an enlightening and informative episode. Thank you so much.
Thank you, Dr. Lakshmi. It was a pleasure meeting you, and thank you for inviting me to this podcast.